All right, and I will now pass it on to Rachel.
Great. And Robin, did you want to mention about the closed captioning if people need?
Oh, right, totally. Yeah, forgot about that. Um,
Mhm.
if you need closed captions, you have the option to turn on at the bottom of your screen under the button More. It should be the very first option. Um, and I also believe Rachel may have it up on her presentation as well. So if you need that, it is available to you.
Great. So thank you, Robin. So it's nice to see you all this morning. I apologize for my voice and my possibly running nose. I have a new puppy that I think I'm very allergic to. So that'll be fun. Um, so for those of you who I don't know already, my name is Rachel Flum. I am a policy and advocacy consultant now, but I spent 16 years at the Economic Progress Institute and so learned a lot about reading budgets and the legislative process there. So I'm hoping to have a good conversation with all of you about what was in the budget that just passed. And I really would like this to be interactive. So please feel free, as Robin said, to interrupt me or to ask questions in the chat. And I hope that, the budget is very like 400 pages long. So there will definitely be things that I haven't included. So feel free to jump in if you know things that you think I should have included, or if you want to talk it in more in depth about any of the pieces that we go over. We should have time to do that. And then Kyle is joining us today to also be another expert on the subject areas for us. So I know, we have a former state representative on the call, so she certainly knows how this process works. But I thought it would be helpful to just sort of start so that we're all on the same page for those of you who don't live and breathe this process, to walk through what um, the process for this budget so far has been. Um, so, the way the system works is that the governor introduces his version of the budget in January. It is his best guess of what he thinks we should invest in and make improvements on for the year, sort of before the session begins. He does it the third week in January. So the session has just started. That is introduced as a bill by Chair Abney. It's bill number 7225. And also when that is introduced, the budget office, the OMB, Office of Management and Budget, does quite a rollout where they do executive summaries and detailed analysis of all pieces of it. Really a press roadshow around that. So if you're interested in this process in the future, check that out in January, and that sort of sets the tone for what the process will look like for the year. He also introduces a supplemental budget. We're not going to talk about supplemental budgets today, but that's basically just wrapping up the year that we're in and making adjustments now that we're halfway through that year. The FY25 budget is for the state fiscal year, which runs July 1st, which is starting next week, through June 30th of 2025. So the legislature has to pass a budget before January 1st, except for the years when they don't. But luckily this year they did. So after the governor introduces the budget, then both the House and the Senate's finance committees have hearings on the different pieces of the budget. Those are hearings where both the fiscal staff explains the details and where the public can weigh in on their opinion. The governor also introduces budget amendments. So this year he introduced about 22. So those are things that came up since he introduced his version, or for instance, the bridge was a budget amendment, um, or things that he needs to make technical changes to, or he wants to indicate that they're big priorities for him. Then in May, there is a caseload and revenue estimating conference, which looks at how revenues are coming in, so how much the state has to spend for the next year, and also how spending is going in terms of programs that have caseloads like Medicaid, childcare, Rhode Island Works, TNF. So that is really the the point at which we know how much money the state actually is dealing with. So this year they found out they had at least 136 million dollars extra to spend, which I'm sure the legislators were thrilled about. So they were able to include much more than the governor's budget. So House Finance introduced their version of the budget on May 31st. At this point, it's not a very transparent process. They introduce it, they read it out, and they vote on it and pass it. So all of those decisions have pretty much been made by the time that budget shows up on May 31st. Then the full House voted on it on June 7th. There were some changes to that that were made in between May 31st and June 7th. And then this full House voted on it, and then it moves to the Senate side. Sometimes the Senate will make changes, but it's not very likely. Usually by the time the Senate gets it, it's pretty much done. So this year that was the case. Senate Finance voted on it on June 11th, and then the full Senate passed it in the middle of the night. So really, I think it was like 12:30 a.m. on the 14th. And it was exactly the same as what passed the House. And Governor McKee then has signed it into law on June 17th. He could veto it, but the process in Rhode Island is that the legislature can override a veto with 2/3 vote. And so if they pass the budget, they already have the votes to veto it. And so it's unusual for a governor to veto it, especially because he's been part of the process all along. So this is how much the final budget was. It was $13.96 billion. That is not the highest or the largest budget ever. Last year was 14 billion, but it is up there. It's the second largest. It was $271 million more than what the governor proposed in January. So they did spend on more things, like I said, because they did have more money. This is just a breakdown of where the money comes from. I think a lot of people think this is all from state dollars, but it really is not. 40% of it is for state dollars. That's the general revenue part. And then 36 is from federal funds. So the budget has to show both the state dollars and the federal dollars. Other funds are things like lottery receipts, and then restricted receipts are pieces that are tied directly to different programs. So they'll tax something and it goes directly to a specific program. As you can see, that's only 3% of the budget. Rhode Island does not like to do that. In some places, they do a lot more of that. So I just thought it was helpful to remind folks that while the budget is about how the state is allocating its dollars, it also does change statute. It does change law when it needs to. For instance, if it's creating a new program, it will both change the law and allocate the funding. This is a link, and I'll show you this later at the end on the General Assembly's website, that goes through all the different pieces of the budget. So you'll see on the right, it has the governor's proposed budget articles, and then in the middle, it has each of the articles. So if you ever wanted to sort of read them specifically, I don't recommend it. Well, it's to get a full picture, it's much easier to read the summaries of the House Fiscal Office and the Senate Fiscal Office. But I think it is worth noting that there are law changes that happen in these articles. So this is an example of a program that was created for primary care training sites. I think it was in the budget for $2.7 million. So that's all the allocations are in the first article, but then in Article 11, they are actually creating this program in law. So it's important to know both of those things. And I think sometimes it can be confusing for people on that point. So any questions on that before I go on into what is in it? Okay, well, again, feel free to stop me. So I thought one the best way for this group to go about this is to break this into 3 topic areas. So first, I'm going to walk through, investments and changes that help the nonprofit sector. Then I'll talk about investments or changes that help nonprofit employees or clients. So they're more sort of generic, but do improve lives for Rhode Islanders. And then the third, as I'm hopefully providing a comprehensive list of just the direct allocations to individual nonprofits. If you think I moved any of these into the wrong category, please forgive me and feel free to voice your opinion on that. I also will sort of briefly talk about things that did not make it into the budget. But this is really not meant to be a comprehensive conversation about all of the things that happened this session. It's really focused on the budget items. So first, investments that help the nonprofit sector, focused on healthcare. The first really big one was around Medicaid reimbursement rates. So the Office of Health Insurance Commissioner, OHIC, did a very comprehensive report last year that made recommendations for rate increases for fee-for-service programs for Medicaid. So these are providers for behavioral health, community care programs, first connections, and early intervention. And OHIC released a report in September of 2023. So then the General Assembly looked at it. The governor actually recommended, because it was a large price tag, that we roll out the increased rates over a 3-year period. The General Assembly decided to put them in all at once after a whole lot of hand-wringing by the programs who were upset with the third incremental step process. So this budget included $160 million to implement those rates this coming year. They actually will start October 1st, so they don't start July 1st. They gave themselves a 3-month roadmap. I know that that's a problem for the First Connections program, for instance, because they have temporary rates that are going to roll back. But generally, this is better than what people expected. If you are interested in what the rates are and what those increases are, those are not included in the budget. So the best thing to do is to look at the OHIC report, which frankly you can just Google with that name, or go to OHIC and find it. And the long report, but it goes through what the current and then increased rates are. The next thing to mention is the Medicare Savings Plan. This was a big advocacy effort for folks with disabilities and seniors. What I'm hearing about this is that the federal government may not actually approve this as is. I think the advocates were hoping they would do this a little bit differently and not just increase the threshold. So it's unclear whether this will go through, but they did increase the threshold for folks who are in qualified Medicare savings program. So it's basically if you're qualified for both Medicaid and Medicare. And then in the mental health space, there were 2 big pieces. Certified community behavioral health clinics is Asina will know about those. These are new. It's a new model that's being created with a federal grant pilot. Currently, I think there are 4 organizations that are sort of ready to go, and the state has to put in a percentage of the dollars. These are actually delayed start, but I think are supposed to start in October. And the idea is that over time, that most or more of mental health services will go to this model. And it will be Medicaid matched if the client has Medicaid. And then the Mobile Response and Stabilization Services, MRSS, which is a emergency response, sort of a call-in way for children or parents with children to get some immediate response in wraparound services. That's been a pilot for a year, and so there's $5 million to continue that. So on housing, you heard that there was a number of things on housing that the speaker prioritized. I think he had 14 bills. These are not those. This is what's in the budget. The housing bond, which was a big advocacy push. So the way it works in Rhode Island is to have things on the November election ballot. The House has to approve, or the General Assembly has to approve putting them on the ballot. So I think there are 5 this year that I'll talk about. The first one is the housing bond. The governor had put in $100 million question. The General Assembly increased it to $120 million. So if the Rhode Islanders vote to approve this, then there would be $120 million allocated. And the House, or the General Assembly, broke down how those $120 million would be spent. So I'm not going to go through all these with you, but this is the breakdown. Significant investment. This would be the largest investment in the housing bond that Rhode Island has ever had. Then the low-income housing tax credit. This is a program that already exists, and so they put in $4 million to pre-fund those commitments that they will have in the future. And then the homelessness assistance transfer is $10 million for lead abatement, rental subsidies, and shelter operations. Kyle, do you have anything you would add on this section that I've left out?
Would add just one qualifier. The first bullet with $80 million, that also includes $10 million for a public developer option. Several members of the advocacy community proposed that there become a public developer to not necessarily to be in competition with, but to ensure consistency in production of affordable housing units, and to work with both our public housing authorities and our federal government to bring additional resources to the table and couple the development of units with and pair them with the subsidy that's necessary to maintain them longer term.
Okay, great. Thank you. All right, let's see. The next bucket I thought it was worth mentioning is the DCYF budget. There's been a lot in the news about the deaths of children this year. And so the state did allocate 35 additional dollars in these categories to try to work on that crisis. So another 21 million for home and community-based services, 5 for adoption and foster care, wage stabilization, a needs assessment, congregate care, DCYS staff, and rates for services. They're trying to figure out how to better do the reimbursement rates. So, this is an area that's been long underfunded, as many of these are. And so this is an attempt to try to get back to where just stable funding, frankly. And then this is just a list of other things that impact nonprofits. So childcare rates. So nonprofit childcare providers are going to see a 5% rate increase if they have children in the CCAP program, the Child Care Assistance Program. The family childcare providers have collective bargaining, and so they have seen an increase in the last year or so. And so this is to get the centers up to that same level. Health equity zones, that was a big advocacy push. The governor had not included this $900,000 to maintain the 15 programs. And so the General Assembly did include it, which is great news. So those can continue. And then the green economy, this is another bond question. There will be $53 million bond on the November ballot that includes 13 million in forest and farmland preservation, and then 3 million to rebuild the cliff walk in Newport. A third bond is for the arts. This would be a $10 million bond that would split $2 million apiece to these 4 organizations across the sector to try to improve the art sector. Okay, I see a chat, but I can't read it, so I'll rely on Robin to tell me if I need to stop.
It was just a question about whether these slides are going to be shared, and that's yes. So
Yes, yes, we will share them. I know it's a lot of words, so we'll definitely share them. So that was my list of things that are sort of directly impacting nonprofits. So next, I was going to go broader. So a list of things that helps employees or clients of nonprofits. So these are just program improvements. So again, on childcare, this is actually for families, $3 million to raise the income threshold for families with children to be eligible for the Child Care Assistance Program. This will put folks at 261% of the federal poverty level, which is, I think, still the lowest in New England, maybe, but is the highest that has ever been in Rhode Island. So that's great news. There also was a pilot last year for staff who work in child care centers to be able to be eligible for child care. So that as a way, as an incentive actually of trying to keep childcare staff employed at childcares. And so that will continue. Pre-K, this budget invests $7 million to further expand pre-K. That money has already been allocated. I think the pre-K deadline for families to apply was yesterday. But this is to try to expand out to more cities and towns. And then Rhode Island Works. This is the state's TANF program, which is for the lowest income families, usually women and children. And so this increases the amount that those families receive by 20%. And it eliminates what's called the full family sanction. So children cannot lose benefits if their parents don't comply with the rules, which is better policy. The other things I wanted to mention here, oh, go ahead.
I just have a quick comment from Kristen Williams from River's Edge that it's actually only for arts sector capital projects for those 4 groups. So Kristen, feel free to elaborate if you'd like.
Yes. Kristen, would you like to explain?
Sure. There was a lot of advocacy around the Rhode Island Creative Futures Fund, which was going to try to, to bring in 18 million, pretty conservative amount of money for for any arts organizations who, particularly those, because the funding from ARPA was never distributed to arts organizations for the rebuild. And so that failed. And that was a sort of a very bad thing. I've spoken with the Secretary of Commerce about that because a lot of people thought that, and the secretary, the speaker represented this $10 million bond issue as something that was sort of like, oh, this is enough for the arts. And we need to be clear that it's not. And also that this is not just funding that we were asking for arts organizations that were doing, I'm going to say arts for art's sake, or arts for tourism's sake, which again, that's awesome. I love that. I grew up on it, but it's not anything for youth development. So we're not seeing any money allocated to something like AS 220, to perishable theater, right, to Down City Design, to River's Edge Arts, to any place that's working with kids. And we also didn't see any additional funding for youth development in any other area in the state budget, while the the governor put his money toward Education 365, which, by the way, also does not go into education. So just throwing that out there.
Yes, thank you for that. I did have later that the 18 million was not included, but I appreciate your clarifying about this. I know that there was a huge push. I think it was very well done push, but apparently wasn't heard. So thank you for that. So in terms of other programs that help sort of the broader Rhode Islanders, there is a new $1 million restricted receipts account that will help Rhode Islanders pay off their medical debt. The treasurer will be in charge of that program. A very small $500,000, and it should be 500,000, not just 500, for the Healthcare Transition Initiative, which is run by Ripen. This supports seniors who are leaving the hospital so they can transition home smoothly and not end up in another facility. And I think it's half state and half federal, so very small funding that saves the state a lot of money. 500,000 for the Minority Business Accelerator to continue some of the grants and work that they did with federal ARPA dollars. And then the Main Street revitalization is to extend that program that also was supposed to end. The other things I wanted to mention here are that the state did expand paid family leave. So now folks can receive, I think it's 7 weeks of paid leave in 2025 and then 8 in 2026. That was a bill, not in the budget, but I think it's worth noting. And then the other big thing, which will help a lot of nonprofit employees, is the Secure Choice program that I know that the Alliance has worked on quite a bit. And this will allow individuals to basically create their own retirement program. If they don't have a pension or a 501c3, they can have a pot through the treasurer to create their own savings. And Kyle, you may know the numbers better than me. I think it's 40% of Rhode Islanders don't have any kind of retirement savings right now. And my guess is a lot of those are nonprofit employees. That sound right? Okay, you're nodding. Good. So are there any other pieces about that people want to talk about or share? Okay, so the next grouping is just direct allocations to individual nonprofits. So you'll see they range from $75,000 to $1.4 million. These are organizations who either ask somebody to put in a bill for them or have an agency that uses their services or thinks it's important investment. So, this is kind of a tricky thing, I think, for nonprofits to decide whether they want to try to advocate for dollars this way. Sometimes if they're advocating for other policies, then it's tricky for them to advocate for this for themselves too. But these are direct allocations. You'll see a number of them are coalitions. So like the Coalition Against Domestic Violence. So that money is being spread. The Alliance for Boys and Girls Clubs spread over a number of organizations. I think to the point made earlier, it sounded like they increased, I think after the House budget was included, they increased the Council for Humanities by 100,000. I could be wrong about that, but I think they did put that in at the end, or maybe it was actually the Substance Use and Mental Health Leadership Council that came in last. But sometimes people will say, "Oh, we didn't pass your policy, but we'll give direct money to this organization instead," which is, not so ideal, but that's how it works. So I just thought it would be helpful for people to sort of see what these are. Any questions on that? And these are not sort of listed in one place in the budget. So if I miss them, it could be entirely possible. But they sort of do it by agency. And so there may be some others that just didn't make this list. So more broadly, not nonprofit focused, but things that I would be I'm remiss if I didn't mention that were included in this budget. Some big things: COLA for former state employees. This is something that Governor Raimondo stopped COLAs for retired employees. This reinstates them only for folks who retired before 2011. So, but it is $27 million. So it will be interesting to see whether that's continued year to year, or what happens in the future for that. There also was a new exemption for retirees from taxes. So now any job that anyone is retired from, there's a cap on income that can't be taxed, and so they increase that from 20,000 to 50,000 or 100 if you're filing jointly. And then the big Washington Bridge, the $84 million from various funds will be the state allocation towards rebuilding the $400 million bridge. And then RIPTA was another big issue. RIPTA said they had an $18 million shortfall. This budget includes $15 million. So it doesn't fill the whole gap, but RIPTA says they can continue to provide the same level of service with that amount. Sorry, I can't see the top of the slide. So then education funding, the funding formula, again, the governor actually had some cuts in his proposal. This budget does not include those cuts. It funded it at the whole amount. It didn't actually invest extra, however, except it did make multilingual learners a categorical category and increase their amount a little bit. So somebody disagrees with me on this, but I think that you would say there really wasn't a whole lot of investing in education in this budget other than keeping the funding formula and investing in multilingual learners. Does that seem right to you too, Kyle?
Agreed for K-12 education, yes.
Yeah. Then for higher education, again, there are two bond questions. One is for URI and another one for RIC that will be on the budget. I mean, on the November ballot for 87 and 73. And then, as was mentioned earlier, there's this out of school time project, the community learning centers that the governor has really made one of his priorities. So this would continue that funding. This is not the After School Alliances programs. It sounds like it's not art education either. You know, these are really kind of all over the map, I think, in terms of what they invest in. But this is, you know, something the governor has really thinks is important to try to get kids in different after school activities. Kyle, anything else you want to say about that?
Can I ask a question, Rachel? Is that the 365, whatever they call it? Yeah.
Yes.
Okay. That's the same.
Yes.
That's what we're talking about. Thanks.
Yeah. And then
I guess, Rachel, I would say one thing.
Yeah, go ahead.
I would say one thing.
Yeah.
If you're seeking funding, the $2 million pool that'll be allocated to mayors, while it's not clear yet, in my opinion, which mayors will receive funding, it is essential that you begin conversating with them today. And I'll just use Mayor's Eye in Newport as an example. Through last year's allocation, one of the high priorities for the hundreds of thousands that Newport received was the summer learning program in partnership with United Way. And I think this is a great opportunity to put flesh on the bones to Learn 365. Many of you are doing work in these spaces and desperately need the resources, but this is a chance, I think, to communicate differently with your municipal leaders. So I would say don't wait until the definition has been provided. I'd say start the conversation today if you haven't already.
Thank you. So these are things that were not included in the budget. As was mentioned, the Creative Futures Fund for the arts, that $18 million was not included. School Meals for All, which is a large coalition, was not included. The budget does include $800,000 for kids who already get reduced price meals to now get those meals for free. So that's better than nothing, but it doesn't sort of expand it for any kids who are not already in the program. And it's really is not a step towards universal. But that is what the governor had proposed, and the General Assembly didn't add anything extra to that. I want to be really clear about this next one, Citizens Bank. Citizens Bank, the tax break that they got at the very last minute was not part of the part of the final budget. It did, however, happen separately as a bill. So it was confusing, I think, for a lot of people, because what happened was the governor had a budget amendment that he put in for this, but apparently I watched Shakarchi on the news program the other day, and he says that the citizens didn't like the governor's budget amendment, so they didn't include that, and then worked with taxation and the governor's office and citizens to pass a standalone bill. So I just thought it was worth clarifying that that was not part of the budget. They sort of found the money after the budget had passed to make that tax change.
Rachel, if I could add for a second.
Yeah.
Many times we hear in the House that they don't pass standalone spending bills. So I think what this does is set significant precedent when we begin to advocate, yesterday for the coming year's budget. There's a new precedent that's been set, and it's a significant number. So when we're asking for individual standalone bills in the House, not just in the Senate, we now have precedent to say that you do indeed pass separate standalone bills outside of the budget and high value items for your priority area. So if you're beginning to work with your champion, your bill champions, your bill sponsors, make sure that you highlight this as something that happens. And while many of them might say that they didn't have anything to do with it, every single one of them voted for it. So they all had something to do in the end, or the handful that voted against, less than a handful. But I do think they all participated in the process. So if anyone tells you that they cannot pass a standalone bill, know that that's not true, because you just saw it happen this year and for a multi-million-dollar deal.
Yes, that's a great point. I'm sure they will hear that a lot next year, because they do say that. They say, oh, we can't do anything now. So now we know that is not true.
And it happened in an election year, which we also said we can't do. We can't do things that are substantial or controversial in an election year. So we saw a separate standalone bill happen in an election year. So if it happened for citizens, it can happen for you too.
Yes. It did not happen for VOCA funding. You saw probably a last minute push, because the federal government is going to reduce the amount of the victims of crime allocation that helps victims of crime. So a lot of the domestic violence groups banded together and tried to get $2 million near the end of session, when it became clear that the federal government was going to have that cut. And that did not move through. So not everything passed after the budget, but citizens did. Another big piece that was pushed for, especially by the Secretary of State, was the State Archives building. He was asking for a $60 million bond to create a building to house the State Archives, and that did not make it onto the ballot. So that will not be there in November. All right, so that's my full list. I was just why don't I go through these last few slides, and then we'll turn off the presentation and chat with folks, if that makes sense. I just wanted to point folks to other resources. The General Assembly website has gotten much better in recent years. So if you go to their main web page, the landing page, you'll see on the left near the bottom, there's budget information, a link. And this is what it takes you to. So you can see, like I mentioned, the actual House fiscal reports and Senate fiscal reports, which I used heavily to create this presentation. Also the budget articles from the bill. You can, on the left-hand side, you can actually see how people voted in both the House and the Senate. And then it has archives of the previous year budget or the governor's proposals. So there really is a wealth of information here. So if you need to find something else, my recommendation to you is really to go to the House fiscal report on the final budget and do a search, because that's sort of the easiest way to find it without reading the whole 400 pages. Okay, so that is my presentation, and I'd love to sort of end this and talk to folks about what you think I left out, what we think it means for the future years, and anything else budget related. Any questions you have? Any big things you think I missed? There was not a lot for the environment this year. Not a lot of environment issues floated up. There was I know the unions were pushing for sort of a green economy bill that didn't move.
Rachel, that's interesting. I'm thinking about maybe 2 years ago, 2022, there were some dollars, somewhere around 10 or 15, that have been allocated to the South Clay project in East Providence. And I believe they were ARPA dollars, SFRF dollars, somewhere in the middle there. But I'm not sure what happens to those, if they've been recaptured and redistributed. But I wonder if there's a chance to review unobligated, unspent ARPA dollars at a later date to talk about last minute opportunities to identify funding sources. Because the environmental issues are more and more significant. And to your point, we're investing less in solutions for people who are particularly in environmental hazardous zones and mostly urban centers, but not exclusively.
Yeah. Yes, the House budget summary from the House Fiscal Office does include ARPA. It has a whole section on the ARPA investments. So we could look back in that and see if they talk about that. And then, I'm sure there will be hearings about it too. Again, there certainly were this year, but they're not done, right? The allocations should have to be spent by the end of this December, I think. So, still money out there. The ladders to licensures, that was a standalone bill, so that was not in the budget. And now you just put it in there. I'm pretty sure that was, they passed it as a standalone. Let me look it up.
It was a standalone bill, Rachel,
Okay.
but I think they also had
Yeah.
included it within the budget.
Okay.
At least that's what House Fiscal had reported. So again,
Yeah, you're right. Yes, absolutely. You're right.
it's a great opportunity for paraprofessionals. Not that we want all paraprofessionals to leave their current role, but it is an opportunity out there for a lot of nonprofits who might have and working in the space of health.
Yeah. Yes, that's a great flag. Thank you for that, Melissa.
So I would add as well, just, 600,000, I think it was, for the community action programs. There are 7 community action programs, and not everybody is really aware that at a core level that we're anti-poverty programs. So that's not a whole lot when you're trying to divide 7 programs. What is it, 85,000 or something? For, food and housing and all the basic human needs that many residents of this state are experiencing. So I just put that out in terms of, not a priority, obviously.
Yeah. Anything else? Anything you think people will be sure to focus on next year that was very glaringly missing this year? I think they've done a good bit on housing. There's obviously more to do. There's definitely arts. Kristen?
Yeah, I would say the other thing that was really not done anything with, obviously we know, was education. And so because of Education 365, I think there was a lot of confusion among the state legislators, thinking that, oh, well, education is taken care of because the name of the program is Education 365. Unfortunately, the first time around, for the allocations, that money, oh gosh, first of all, I mean, there's so many problems with it. Giving it to the mayors is an issue in itself because most of them don't have grant writers on staff, which meant that unless they were willing to cede authority to local organizations that do have grant writing experience, those grants were terribly written. In Woonsocket, we had them written within 24 hours, and that was only because 3 and 4 and 5 weeks ahead of time, we pushed to have the mayor do that. Obviously, our mayor was always a special case. And Kyle knows what I'm talking about. But at any rate, I mean, even someplace like Rivers Edge Arts that has a long relationship with City Hall had a lot of trouble getting them to pay attention to the fact that this had to be written by a professional grant writer. So that's the first issue, obviously. But he's going to do what he's going to do because he wants to empower mayors. I totally get that. But even again, in our most latest work with Chris Beauchamp, again, we worked very closely, and I say we, not just Rivers Edge Arts, but the Woonsocket After School Coalition, which is 6 organizations, including the Boys and Girls Club, so it's not little or ineffective. Even then, we were writing for stuff that should have been part of education funding generally, not just this Education 365. And like I said, that first education money was very clearly not for programs. It was for capital projects, which I thought was really interesting, or community buildings to house programs later on, which again was really interesting because it suggested that those programs don't already exist, which they do. And those community organizations don't already exist. So that was something that was an issue. The boost bill has been something that has been on the radar for some time. Unfortunately, the Rhode Island After School Network just didn't do a great job advocating for the passage of that bill. Nothing like as organized as the Rhode Island Coalition of Artists did for the 18 million for ARPA funds, which also wasn't in the end persuasive. So I would say that those two things are things that we're going to have to look at for next year, not only for arts funding, which again includes youth development funding, and frankly, because of the work we do and some other organizations in Providence are doing, that is also money that goes toward DCYF's interests in making sure that we are not having kids end up in the training school and residential facilities. So that to me is something that that needs to be looked at as well. I think just as the CAP point of view there, which was super important, which is that this is an anti-poverty stuff. Similarly, youth development is also anti-poverty. And so it's really hard to make that clear to folks who don't really understand why arts funding is really key, particularly someplace like AS220, Down City Design, Rivers Edge Arts, because we are making sure that kids are not ending up there, and because we're one of the only places that non-binary kids will go, or LGBTQ kids will go for work. And if, of course, you want your future engineers, you should probably send them to arts programs. So just throwing that out there as 2 areas that I'm certainly going to continue to harass people about.
Great, thank you. It's true. I think the legislature and the speaker are and the Senate president are very proud of this budget. But there are still a lot of gaps. So I appreciate that. James?
I,
James?
Could I get some more clarification, I guess, from Ms. Campbell or whatever on the paraprofessional bill? Because I didn't know anything about that, so I don't know what the background of that is.
So I think she put that in the chat. It's the Ladders to
Okay.
Licensure. It's a grant program. Are you familiar with that? It says, okay, so I think I'm just reading what she's put in the chat. There's 750,000 from general revenue for the first year of a 3-year program, totaling 5 million for public or private partnerships that provide opportunities for healthcare paraprofessionals to pursue or higher education degrees in health professional licensure.
Great.
I guess the employers would contribute 25% and then a 10% cash match.
I did put the Senate bill number in the chat box. Sorry, I didn't include the link, but that will give you a little background on that particular bill. It was a package of bills that were aimed at primary care that also encompassed the wave maker dollars specifically targeted towards primary care clinicians, as well as the primary care training sites. So it was part of that package that was developed by a group of folks.
Thank you.
Melissa, do you want to talk more about the primary care piece? I know that was a big issue for because we have a big crisis around the access to primary care doctors. So do you want to talk more about that?
Sure. Again, I think everyone is experiencing this across the state. And so CTCRI, working with some of our partners, including the Health Center Association, Rhode Island Medical Society, we're all charged to develop some bills in response to, we would call it a crisis in primary care. And so a set of bills was developed. And what was a little, like, one was a scholarship, which is great, the wave maker. Another one was, expanding these ability to do primary care training for new clinicians. And this third one to really address it, not only for paraprofessionals, but also to increase and create a more equitable and diverse workforce in healthcare, the ladders to licensure, specifically. The one bill that we did ask for, we asked for $1 million in our health professional loan repayment program, which specifically is for licensed clinicians, and that it would include docs, nurses, dentists who work in our safety net or our health professional shortage areas, as we call them here in the state. Unfortunately, that did not pass. So we received some federal dollars to support that program, but the state doesn't contribute to that program. So that was our one, kind of our bummer in the four pieces of legislation. So, but happy to see those.
I know there was also, yeah, and I know there was also conversation about whether to include primary care doctors in the OHIC rate review process. Were you part of that conversation at all? I think it ended up not passing.
Yeah, I don't think that ended up. Yeah, I think that did not kind of go through, right? Because that sort of came along after I think these four were packaged. So that was one other piece that I remember. We obviously have a lot more work to do to ensure that everyone can have access to, particularly in this primary care space. So we'll see what next year holds.
Thank you. For whatever reason, a lot of the hearings I attended this year had those primary care pieces involved. So I heard a lot of testimony, and I think there are a lot of legislators who have had that experience of not being able to find their own doctors for themselves or their family. So it definitely resonates.
Yeah,
but
it is very tough times, I think, in accessing care. But the other bill that did not go through, which isn't part of that, was the 5 years continuous coverage for kids under the age 6. So 5 years Medicaid. That was a little disappointing because I think that's always helps to reduce and ensure those kids are covered regardless of some administrative issues or not. So
yes, that's a good point. All right. Anything else that we should mention? So it is an election year. So I think the filing deadline is Thursday, maybe. So they'll probably, I think they're I don't know, 6, 7 folks who've said they're not running for office again. And then we'll see who pops up for new contests this year. So, if you're unhappy with what's not in this budget, this is your chance. It's a good time to be unhappy because it's a good time to make your voices known. And I think for nonprofits, I always love to see nonprofits put out briefing materials on the issues that are important to them for candidates, because they can then help educate candidates on important issues and then make relationships with them going forward. You never know which newly elected person will rise quickly in the ranks. So it's important to make friends, even if you think, oh, well, they're new, they're not they won't have much power. That may be true the first year, but things change. So this is a good opportunity for engagement. Anything else, Kyle?
I wonder, I'm not sure if anybody on the call is hosting an engagement for elected officials and candidates. If you are, we'd love to know about it at United Way. We're thinking not only how do we encourage increased voter participation, but also how do we increase access to candidates and incumbents alike. So if you have an event where you're convening elected officials and you'd like to, allow us to share it, we'd love to be helpful in that regard and getting the word out to make sure that as many people as possible can get connected to candidates and incumbents over the summer in preparation for the primary.
Right. Are you guys hosting anything that you know of yet? The United Way?
We are not. We're intentionally trying to support others who are, and both by getting the word out and where possible, providing some resources. But we think that's going to be our best opportunity this year.
Great. Okay, great. Well, I think we're about at time. So here are our email addresses if you have other questions. Kyle has a new fancy title, Chief of Staff and Public Affairs Officer. More words, more responsibilities, right, Kyle?
That's it.
But so thank you all for joining us. I know either of us would be happy to answer other questions that come up. And then I'll turn it over to you. Robin, do you have any last closing pieces?
I will be sending out the slide. So contact information will be there as well. To Rachel's last point, that was a great plug for Advocacy 201. So if you have a legislative agenda for next session, want to workshop it or build on those skills to be able to better advocate for yourself and mobilize your constituents, I would encourage you to apply for that. It's going to be a small cohort meeting monthly. So not as big as a lift as our other cohorts that have been running. But other than that, I think that's it. So thank you so much, everyone. I'll be following up with you if you have any questions, and hope you enjoy the rest of your day.
Thanks, everybody.